paediatric dietitian, so I've worked for the NHS. For 8 years, I did some private work actually as my first job. I've always worked with children. So as soon as I qualified, I was straight in working in paediatrics. And then over the last few years, I've really specialised with children who have food allergies, but also children who are difficult feeders, feeding aversion. But I've got a real sort of specialist interest in food allergy. It's an area that's constantly changing, which we'll talk a little bit about today, because I know it's also an area that raises endless questions with parents. So we thought it would be really good, didn't we, Kerry, to cover introducing allergenic foods in weaning. And it seems to have been a really hot topic this year. There's quite a lot across social media talking about it. So we'll just go straight in. So I think I've given a kind of rundown. I'm a little bit more loose than that. I tend to just go with it, and we will do questions at the end. Just to say on that note, I won't be able to give any specific advice about your child, obviously, because I don't have their history. So general questions only, if that's all right. Right. Weaning. So weaning's a really challenging time, I think, for any parent. I think it's that mix between being really excited to be getting going, but also being completely overwhelmed with what food do I start with? What do I offer first? What method of weaning do I want to do? What happens if they reject it? What, you know, lots of ifs and buts and unknowns. And one of the areas that I know that really is quite anxiety provoking for families, and was certainly shown in some research actually by is your baby club, that around 50% of parents are very worried about children developing food allergies, and weaning being the time where those start to manifest and that you start to pick up on those. I think that's really normal, can I just say, for all parents to be anxious about that process. I think the key thing really, and what I hope you'll be able to take away from this workshop, is to feel more confident in how you go about it, how you spot for any signs of a reaction, but also being really pragmatic that actually most babies won't be allergic to food. And it's really important to remember that whilst you hear, and I know we hear a lot in the media about rates of food allergy rising and rising, yes, whilst that does sound like it's true, the key thing really is that most children won't be allergic to any food. So that's a good thing. So we think around sort of 95% of children will be absolutely fine. It is that small percentage who won't, and who might go on to develop food allergy. So allergenic foods, I suppose, what am I talking about would be a really good starting point, wouldn't it? There are some really key ones that you'll probably be thinking about. This is where we test if I can remember them all. So you've got cow's milk, so often referred to as dairy. A note on that one is that lots of babies, particularly if they are formula fed, will have been exposed to the cow's milk protein already. So for any babies who might have milk allergy, they will probably know about it before they start weaning. The exception to that rule is typically babies who might be breastfed and who have tolerated mum consuming dairy and then might develop symptoms once they start weaning. After cow's milk, one of the most common food allergens that you have in babies is egg. And then you've got peanut and tree nuts. Just a note on that, peanut and tree nuts are two different things. Peanut is a legume, so a little bit like a pea or a lentil or a bean, whereas tree nuts, as they sound like, are grown on trees and bushes. You've got soya, wheat, fish, shellfish, and then you've got things like seeds, sesame, so that might be tahini, often children exposed to it first in something like hummus. I'm checking to make sure I haven't forgotten anything. I'm sure I said soya. So those are the key ones. There are other common food allergens, but they're the ones you're probably going to be getting in with baby during the weaning process. So the current advice about getting all of these foods in now is that you do not discriminate them for most babies against any of the other foods that you're introducing in weaning. So you don't delay introducing these foods once your baby is around 6 months of age and they've started the weaning process and you've got some of those first foods in. So that might be things like bitter vegetables, and you might have progressed on to fruits and starchy foods and iron-rich foods. Do you introduce these too? So there used to be a lot of reluctance about introducing these foods in case a child shows signs of an allergy, but actually what we would say now is that it's very important that you try and get all of these foods in before your baby is around 12 months of age. And that is because we want, so this keeps turning itself off, that is because we want the immune system to have been exposed to all of these proteins early. And once we've got them in early, we also want to give them often. So if there is a take home from this, it's about getting it in early during the weaning process, and it's about then keeping them in and giving them often. And I'll touch on that for perhaps some of the more high-risk babies later. So pragmatically, okay, you've got this big long list of allergens now, and you think, how on earth am I going to get all of these in? I always say to families, sometimes having a list and thinking about which foods that you want to introduce and when can be really helpful, or a planner just to keep track. The key things really when you're getting them in are introducing one food at a time. So for example, if you were introducing egg for the first time, try not to introduce egg and toast, egg on toast or something on the same day, because if a baby does show any signs of a reaction, you're absolutely not going to know which food allergen that is. Other things really, it's really normal to feel anxious and worried about this. What can be really helpful is to understand signs that you're looking for in terms of what might my baby show. If, you know, what are signs of an allergic reaction? So I will cover that once we get to the end of these sort of tips. Number 3 would be start small. So don't go wild with a big old portion of something. In all honesty, baby probably isn't going to take a large portion of anything at this stage, to be honest. So for really allergenic foods, so things like peanut and egg, you might want to start with about 1/4 teaspoon and build that dose up every sort of day for around 3 to 4 days. And it is really important, I can't stress this enough, that you do one at a time and then you perhaps do it slowly. So you do it over a course of 3 or 4 days and you know the baby is okay. That also allows you to determine whether or not your baby is having any delayed reactions, so signs of an allergy that manifests not straight away, so within 2 hours of consumption, but something that might manifest later on, sort of 24 to 48 hours later. And that might be more common with something like cow's milk, soya, egg, but can be a range of foods. After that, it's really important where you can to try and introduce it early on during the day. So try not to introduce a new allergenic food for their last meal of the day, perhaps before they go to bed, because you haven't got eyes on baby for the rest of the day, just to see if anything is manifesting or if anything is okay. So definitely early on in the day. So once you get going, if you have any worries and if you have any signs and you think, oh, I'm not sure, you know, is this an allergic reaction or this has happened, make sure you document it, because it can be really hard to remember anything that's going on. If your baby develops any sort of rashes or any sort of eczema flare, anything like that can be really helpful to take some photos too, because these are the sorts of information that if you do suspect your child has a food allergy, can be absolutely invaluable to your GP, your health visitor or the allergy team if they needed to see them. So I'm just checking here, I've gone through everything. So start early in the day, offer a little and build it up, watch for signs of a reaction, make sure you do one at a time, and still try and enjoy it. You know, there's lots of ways that you can give these foods. So, you know, I always get asked, well, how on earth do you give baby an egg to start off with? And often really easy way of getting it in is boil up an egg, mash it down and mix it with something you know that your baby might have already. Now, if they reject that straight away and they're spitting it out on this, do not worry, just stop and try and have a go on another day, because there's no reason to push it or force it in. It absolutely doesn't bode well, ramming it in, trying to make sure baby's got it in so that you know that they're okay. Some of these foods are going to have a really strong taste and a really strong texture, eggs and peanut being really good examples. So it might take a little while for your little one to get used to it. Yeah, so that's introducing allergenic foods. Now, I'm going to talk a little bit about the children who would be higher risk. So there is this really interesting evidence, and I should probably have talked about this at the beginning in all honesty, but the reason why we have done a whole 180, so a big old U-turn in terms of introducing allergenic food and being really focused on getting it in early and proactively during weaning, is because around 20 years ago, lots of the advice, particularly for children that would be considered high risk, so where parents had a history of atopic disease, so that's eczema, asthma, hay fever, or food allergy themselves, we, as the UK, the Department of Health, we said absolutely do not consume things like peanuts during pregnancy, don't consume them when you're breastfeeding, and definitely don't give them till they're at least 3 years of age. And actually what we saw with that was the complete opposite of what we wanted. So we were seeing elevated rates of food allergy, particularly peanut allergy when you look at those rates, we saw rates absolutely soar over the course of sort of 10 years in terms of rates of peanut allergy. And that led to researchers stopping and going, okay, hold on a minute, this can't be working. And then they started to make some observations in countries where certain foods like peanut are introduced very early on during weaning. So in Israel, it's very, very normal for babies to have a weaning food called bamba. Bamba is actually really delicious. You can buy them in the shops here. It's like a What's-It, but it's coated in peanut rather than a sort of cheesy coating. And this is a really common weaning food that they give early to their babies, and they keep giving. And really interestingly, some clever people, some clever bods in London noted, hold on a minute, the rates of peanut allergy in these babies and in this population is extremely low. Is it because we're giving it early? And this led on to some really, really big research that's been done in the UK. So there's been the LEAP study and the EAT study. Anybody who wants to go and read about those, you literally just have to Google them, which have absolutely shown quite definitively, particularly in high-risk groups too, so I'll go on to that, that introducing these foods early really helps support tolerance, so not getting the food allergy. So it's exposing your body to those proteins early. So the LEAP study was just focused on peanuts, and it was going, okay, if we give peanuts early and we keep them in good doses, these children went on to not develop peanut allergy compared to the group in the study who didn't give it early and often. So that's where all of this research has come from. And then the EAT study looked at a lot of other food allergens and found very sort of similar findings in the children that were able to adhere to their protocol of getting some key food allergens in. I think it was quite difficult. There are about 6 food allergens in very young babies every day. So it was all regularly during the week. So this kind of leads me on to the high risk group, and this will apply to a small percentage of babies, but it's really important that parents know if their baby falls into this category and where to go and get some help. So as I said earlier, for most babies, that will be probably around 95% of babies, they would be considered low risk of food allergy and should just put those foods, allergenic foods, in their diet from whenever they start weaning onwards, so around 6 months of age. Now, babies who are high risk, so they would be children who had eczema, particularly if that was severe, so moderate to severe eczema. So that, if you're looking for a sort of categorization of how do I know if my baby's got mild eczema or severe eczema tends to be one that requires some steroid creams on a regular basis. So, and liberally across the body alongside sort of emollients. It is also more common in babies that develop early onset eczema. So babies who have started getting signs of, symptoms of eczema within the first few months of life. And often this is within month 2 or 3 onwards. So that is quite early. So that would be one high risk group. And the second high risk group would be a baby who's already known to have a food allergy. And so for most babies, that's going to be cow's milk protein allergy. And there will be a percentage, I'm sure, of parents here who may well have babies with milk allergy. And those children would be considered at a higher risk of going on to develop further food allergies. And in view of that, they're also the group of children who are probably going to benefit most from being proactive with the introduction to these allergenic foods. So that can feel really daunting because you've got a parent who's used to managing an allergy already, and there's people probably nodding along thinking I'm absolutely terrified. But equally, on the same standpoint, you're also probably a parent who doesn't want your child to have any other food allergies, because things like cow's milk allergy and egg allergy tend to be outgrown in children, whereas something like peanut or tuna allergies or fish tend to be something that persists for a much longer period of time, if not lifelong. So being really proactive can be quite protective here. So the advice for those children is that you might want to consider introducing allergenic foods very proactively from around 4 months of age. Now, obviously, excuse me, I'll have a sip of my coffee. I'm talking. So for those children, what's really important is, again, you want to make sure they're still developmentally ready for weaning. So it's not like they hit 17 weeks. We shouldn't really be introducing much before 17 weeks at all. It's not like you hit 17 weeks and you have to get it in. But what I'm saying is that there is this window of opportunity from 4 months onwards, when your baby is developmentally ready to wean, that you start introducing foods as normal that you would in weaning, and then be proactive with introduction of allergens. If we had to pick two, we would almost certainly say start with egg and then peanut and work on getting those in early. And again, following the same advice that I would give to anybody, which is plan it out, start small, introduce early on in the day, and be really aware of whatever the signs might be for reaction. Now, and I will talk about that. Now, the other thing is, and I get this a lot, Lucy, I've done it. They've got peanuts in. We've had a teaspoon of peanut butter. That's it. Wonderful. No allergy here. Really, really, really reassuring and wonderful. The thing I would say then is it's really important to keep it in often. So we need a baby's and child's immune system to keep having exposure to that protein to maintain some tolerance. So if you get peanut butter, for example, in a baby, and they have managed to absolutely no problems, what we would be looking for is to then try and keep it, oh, I told you I'd knock that over. We would try and keep that in for 2 to 3 times a week and about a teaspoon's worth. Now, I can talk about how you can introduce peanuts as well. For egg, it would be the equivalent to trying to get in about a whole egg a week. So most babies, once they're eating relatively well, can probably manage a quarter, half an egg at a time, so you might want to spread that across the week. Other things like wheat, you're probably naturally going to get that more regularly into your baby's diet anyway, because it falls into things like cereal, like Weetabix, it falls into toast and pasta and couscous and all of those sorts of foods. So they perhaps might be a little bit more easy. So I hope that's quite clear. But we can always go through any questions at the end. Now, I keep saying I'll refer back to what are the signs and symptoms of an allergic reaction. Now, I am absolutely not going to be able to give you a whole exhaustive list of all of the symptoms. So I would absolutely think that it would be helpful to direct parents to just the NHS website, but also Allergy UK have some fabulous resources all about spotting possible symptoms of a food allergy. I think what's really helpful for parents to know is that there's 2 types of reactions. So you've got the reaction that would be more immediate, and you would probably be more likely to see this with food allergens such as peanut and perhaps egg. And then you've got delayed symptoms. And again, you might be more likely to see that with things like milk, soya, but it can cross all of the allergens that we talked about earlier. So immediate symptoms, again, might affect a number of body systems. So you might have some skin symptoms, which could be things like erythema, which is the big posh medical word for redness and a lot of flushing. You might see hives, and people would normally recognize those as those big wheals, big red wheals that children develop quite quickly across their face and their body and might spread. You can develop a range of rashes. Now, it's difficult with babies because they like to get rashes anyway for lots of other reasons. But again, it's a rash that might come up quite quickly. Or if it was a more delayed symptom in terms of skin, you might see some worsening or some severe sort of reddening and exacerbation of eczema that a baby has already, or that's spreading or becoming, a little bit more widespread across their body. From a gastrointestinal point of view, that's one of the other body systems often sort of affected by food allergens. Immediate symptoms might be baby vomiting it up straight away. That can be very common for egg. Lots of people, in my experience, will say baby vomits it up. So you might have vomiting, you might have changes in stool patterns, so you could have diarrhea, very loose stools. You might see some blood or mucus in stools. Again, that's often more common with food allergens like milk. You can sometimes see constipation. And again, it's important to remember some of these, that would obviously be a delayed symptom, and constipation can be more common during weaning anyway. Real top tip here is to look out particularly for milk. In terms of constipation, it can be very normal to see soft stool constipation. So that's where a baby would be straining and straining and straining to pass a stool, but when the poo appears, dietitians like talking about poo quite a lot, you probably gathered. The poo's soft, and you think, well, why on earth would they need to strain to get that out? So you might see some other GI symptoms. So you might see real exacerbation in reflux. That's often a more delayed symptom, but it might be immediate. And again, baby sort of demeanour often changes around that. They might be very reluctant to start accepting that food or spitting it out all of the time, and become sort of in their way of telling you, no, I really don't want to eat that, because there's lots of things babies can't tell us, like that's tingling in my mouth, then that really makes me feel quite nauseous, and you're there as a parent constantly trying to work out what's going on the whole time. So we've done skin, we've done GI. Obviously, we've got to talk about respiratory system. So that's breathing, nose, mucus, all those sorts of fun things. Key red flags for anything immediate would be a baby who's quite evidently struggling to breathe. Now, to reassure most people, this is very, very, very rare. And actually, even in the studies where they looked at early introduction to allergenic foods, they didn't report any severe reactions. So it tends to be, if they do have a reaction to something like peanuts during weaning, that the reaction is quite mild initially. And what we sometimes see is those the history then of reactions as they become older becoming more severe. That's not to say it will never happen, because I simply couldn't say that, but it is honestly really uncommon to see a severe reaction. But red flags respiratory wise, so anything that would suggest any swelling around their mouth, their throat, their lips and their face. But really, if they are showing clear signs they're struggling to breathe, they have a hoarse cry, lots of parents describe a lot of secretions, like sort of a cough. Those are the sorts of things where you probably need to be thinking about dialing 999 straight away. Again, really, really rare. So, you know, be aware of these things, but don't think the worst scenario. You're much more likely to see significantly milder symptoms. Now, some children also develop sort of a real runny nose, runny eyes, eye watering and those sorts of things. And again, these are really visual symptoms that tend to occur quite quickly. I'm trying to think what I've forgotten here. So we've done skin, and we've done breathing, and we've done GI tract. The other thing really, and these are much more subtle sort of reactions, are things like a baby's growth. So sometimes we see babies who are really struggling with their weight gain, and often that's corresponding to gut-based symptoms like diarrhea, and that just means that their body is not absorbing all of the nutrients they need because there is some inflammation within the gut, meaning that they are struggling to absorb those nutrients. And again, that might be more common with things like milk allergy, concurrent soya allergy, and those sorts of things. But what I would really encourage you to do, because there are so many lists of reactions and possible things to keep an eye out for, is just familiarise yourself with those beforehand. If you're ever not sure, document, take pictures and discuss it with a health professional, because each baby is different. How symptoms manifest are always very different. But the take-home message really is that a reaction, particularly a severe reaction, is very, very unlikely. And so even with something like peanut, that seems to be the one people worry about most. Reactions in children that we do see do very much tend to be mild initially. So I hope that puts lots of parents' sort of minds at ease. I'll probably stop talking, and then people might want to ask questions.
Yeah, well, thank you so much. That's really informative. As somebody who has peanut allergy themselves, I actually found that really useful, because I was terrified of giving both of my boys peanuts and almonds actually as well. So that was really, I wish I'd had that advice 10 years ago, 13 years ago. But we have actually got some questions. We've got one from Harriet. My 4-month-old has eczema, which appeared from 2 months, and after a very small amount of cow's milk-based formula, has a severe reaction, wheezing, flushing, swollen lips. So pretty sure he has cow's milk allergy. There's also asthma and hay fever on both sides of the family. What professional advice should I seek before introducing solids, as I think he definitely falls into a high-risk category? That's from Harriet.
Yeah, so thank you, Harriet. That's a really good question. So if your baby's got an allergy anyway, your GP should definitely know, and you should be being referred to a dietitian. So you see someone like me. We're across lots of hospitals across the country. So refer to a paediatric dietitian, and they may very want to refer you to a paediatric allergist, so a paediatrician, to support you with that. Now, the one thing I would say, and I talk about this a lot, is that everyone's like, Lucy, that's great. I understand all of the advice about early weaning and I want to be proactive with it, but I want to do it with some supervision. Be proactive about going to your doctor, getting some advice and getting referred as quickly as you can, because you do have to weigh up the difference between waiting for an appointment and waiting to be seen versus delaying introduction to those foods, because the window is so small. And I appreciate there will be lots of people that say to me now, that's really frustrating, because you want to be able to go get in and see someone really within a few weeks, a month, so that you've got the advice, you've got the reassurance and you've got the supervision. Now, with the severe eczema, Harriet, and the food allergy, clearly, yes, high risk category. So I would be going and pushing to go and see an allergy team sooner rather than later.
Okay, we've got lots of questions coming through, so I'll get through them as quickly as I can. This is from Philippa. I suspect my child is allergic to strawberries and tomatoes as a red rash appears around the mouth and lips. Would you recommend private food allergy testing or going via the NHS route?
This, for a start, so it's Philippa, so this brings up a really, really interesting topic, which we'll cover because it's very sensible. Foods like tomatoes and strawberries are real culprits for something that's known as a contact reaction, so around a baby's mouth or perhaps on their face or hands where they've touched those foods. That's not a food allergy. That is babies have very sensitive skin, and those foods, particularly ones that are acidic or very high in histamine naturally, so things like strawberries, cause that irritation, but that's not an allergic reaction. It wouldn't suggest that when your baby ingests those foods, they're going to have anything more severe. So all I would say is that doesn't sound like food allergy unless you've got some of the other symptoms too. Some barrier cream, just like a simple emollient around baby's face before they start having foods like that can sometimes help protect. And on top of that, there's no reason to not give those foods as long as there's no other signs or symptoms.
Okay, moving on to Kate Hughes. I've read that if there's a family history of eczema, you need to be careful with introducing peanuts, even if there's no sign of baby having eczema. Is this true?
So we know eczema is the key thing that we're looking for now in terms of food allergy risk. But yes, of course, there is also the fact that a family history, sort of atopic history, which is eczema, asthma, hay fever, and food allergy, may increase a baby's risk of food allergy too, but not as significantly as if they already have a food allergy or they already have eczema. So they would still fit within sort of towards the lower risk group. So just introduce, as I say, from around 6 months of age during weaning.
That I think leads nicely onto a question from Anna Finch. Please can you recap the amount of allergens per week to aim for? Which would you recommend starting before 6 months, and is that after a bit of vegetable for a couple of weeks from a 4-month-old with severe eczema and reflux?
Okay, again, I can't give any specific advice regarding children, but what I can say is, so the amount of allergens to keep in, so if you're looking at something like peanut, you're looking for 2 grams of peanut protein sort of 2 to 3 times a week. That's the equivalent to about a teaspoon of smooth peanut butter, which often children cope with best mixed with something because it's quite tacky texture, isn't it? So mixed into purees, porridge, sauces, or really well ground peanuts in the same sort of quantity. If you can get your hands on something like the Bamba snacks, which are like those What's-It sort of meltable crisps, that about 50% peanut, a baby would need to be having about 2/3 of a bag of those for 1 dose. So often people find it much easier to get in sort of smooth peanut butter. I should definitely caveat whilst I'm here with, please obviously do not give babies any whole nuts, and we wouldn't be recommending that till children are 5 years of age anyway because of the choking risk, but be very mindful. I tend to say avoid any chunky peanut butters, sort of crunchy, because you can't always guarantee the size of those chunks, so smooth, always better to go with. In terms of egg, the amount to get in is around an egg a week once you've got it in the first place. So again, across 2 to 3 doses throughout the week. There's no need to trickle it in sort of every day unless that was a normal part of your baby's diet. I think everyone's mind would be blown if they had to get all of these foods in every day. Just offer them as part of a balanced diet, 2 to 3 times a week. I'm just checking what the other queries were regarding that. So in terms of weaning, you would probably start with your bitter vegetables and your first foods, and then you would look to get your allergenic food in after a few weeks of doing that. And in terms of the higher risk children, we would normally say egg, and then we would say peanut, and then continue through the other allergens.
Okay, I've got a question from, I'm sorry if I pronounce this wrong, but Archana. My doctor feels my baby is allergic to cow's milk protein, but we've stopped and seen no improvement in her reflux. When I start weaning, shall I still use cow's milk?
Okay, a really important measure for supporting diagnosis of any delayed food allergies, because that's a really, really challenging one for parents. There's no test for a delayed food allergy. There's no way of doing a skin prick test or blood testing or anything like that. So if you're not sure and you need to confirm a delayed food allergy, this should be with the support of a doctor and or a dietitian. But if a food is removed, it then needs to be reintroduced to confirm the symptoms. So taking something away on its own without a reintroduction is very difficult to determine whether or not a child is actually allergic to that from a delayed perspective. So I would be considering doing something like that before thinking about how you get them all in during weaning, if that makes sense. Oh, I've lost my sound.
No, it's me. It's me. This is from Naomi. Can vinegary breast milk poo be an indicator of a possible allergy or intolerance?
Oh, it can be an indicator of a number of things. So I can't say that as a single symptom. Yes, it would need to be a really good allergy focused history taken from somebody who understands that, because there are lots of other things that affect GI tract in babies, you know, viral infections, bacteria, a whole host of things. So I think that would need a GP referral first, just to see what was going on. I know it's really hard kind of constantly trying to interpret your baby's symptoms and see if it is food allergy, but I cannot stress enough, if you're not sure, you need to be going to get medical advice for your baby. Don't start chopping and changing and taking things out of your diet if you're breastfeeding, or going about it on your own, because there's quite significant implications from a nutritional perspective for mum if she's breastfeeding, but also obviously for baby as they go through the weaning process.
Okay, and I think this is the final question from Oksana. And again, apologies if I've not pronounced that right. Hi Lucy, thank you for all the information you gave us. I find it really helpful. My little one is 7 months old and she has milk, egg and wheat allergies and has had eczema since 2 months old. I wanted to introduce peanut to her diet, as you said. However, the GP has said not to introduce any other allergens to her diet, such as fish, peanuts and strawberries. I'm confused what to do. We're still waiting for a referral to a dietitian.
Yeah, that's really frustrating, isn't it? Again, it's really difficult for me. She would obviously sit in a significantly higher sort of bracket in terms of reintroduction. What I would encourage, there's probably going to be a lot of questions that are quite personal about, you know, people's babies, is take a really good read through the Allergy UK weaning support pack that's come out about weaning allergic baby. It's really comprehensive and covers quite a lot of the questions that people are coming up with. In terms of waiting for the referral, I think I mentioned earlier that there's obviously this huge frustration for people that I want to know what to do and I want to be able to do it confidently with support, but I'm still waiting to see somebody. I would suggest a few things. One, if you already know that you're under a team or a dietitian, but you're just waiting for an appointment, these services are still open. So go and give them a call, see if you can speak to somebody over the phone and explain your child's circumstances, see if you can expedite the appointment earlier. I mean, I work at a big children's hospital. We've been doing all of our clinic appointments where we can over the phone. And I know lots of the allergy team, I work with some paediatric allergists, have been doing similar things, Zoom calls, conference calls, those sorts of things too. I'm just going to move that because I'll knock it over. The other thing, as I said earlier, is that once you've skilled yourself up and sort of taken some time to understand all of the data around this, and again, the Allergy UK resource pack's really helpful, is as a parent you need to consider what you're, you know, weighing up that risk of waiting versus having a go and getting it in and being very sensible and pragmatic about how you do it. But I understand for a lot of people that's going to raise anxiety levels through the roof. So be careful with where you get your information from. Go back to your GP if you're not sure and you need a referral. And if you're already lucky enough to be under a service or at least allocated to a hospital or a team, I would encourage people to give them a call and see if they can give you some more advice that's for your baby. Because allergies are quite complex and it requires a really good history taking. I can spend an hour talking to a family just to get a history before we decide a plan of action. So yes, I appreciate there is going to be huge frustration about allergy services and availability at the moment.
Hi.
Oh,
hi,
hello.
can you? Hi. My little one is almost 8 months. He's been baby-led weaned. He's had all of the main allergens and everything has been fine. And then a couple of days ago, I saw on here actually, on weaning week, it's good to introduce all the bitter things, and he's enjoyed broccoli and things like that, but he'd never had spinach. And we had spinach and with a different new herby chicken at lunchtime, and he came out with all a blotchy face and hives all on his face and neck. And I thought it might be the herby chicken because that had like lots of new things on it. So I didn't give him that later on in the day, but did give him a single leaf of spinach. And the single leaf of spinach made his face really, really bad and his whole torso covered in, you know, like swollen, hivey, like nettle rashy type.
Yeah.
And then at bedtime he was sick 4 times, and he's not a sicky baby either. So is this an allergic reaction? Does it mean he's more allergic to other foods? Do I need to get referred? What would you suggest?
I would suggest definitely going to your GP, taking some photos. I would get him referred just to make sure it's nothing else. Obviously, spinach is a much less common allergen. If you've got all of the other allergens in successfully, please keep giving them. There's no reason not to. But it's the combination of symptoms would certainly fit with a pattern of food allergy. You're welcome.
Okay. Thanks, Danica. We just had a couple more through. My daughter this is from Emma Hurst. My daughter's 8 months old and wasn't diagnosed with CMPA until she started weaning at 6 months old, despite regular trips to the doctors. I'm now concerned she has delayed reactions to soya, egg and coconut milk. I've stripped her diet back to just fruits and veg so I can slowly reintroduce them to identify which ones she's allergic to. How long would you leave it before reintroducing, and how long would you leave it at 8 months before trying peanuts and eggs? We haven't been referred to a dietitian despite asking, so I'm going it alone with Google. And then she asked about bad nappy rash as well. So if you can kind of touch on those as well. And just that ties in nicely with Harriet's point as well about how you can see a dietitian private.
Okay, so you can find a private dietitian via the freelance website of the British Dietetic Association. So they will have a list of dietitians by area. You can probably tell I'm really passionate about people being able to get access to professionals locally in the NHS, because that's what we're here for, but I understand there is huge disparity in services across the country. So yeah, just make sure that it is a freelance registered dietitian, so from the BDA website really. It does need to be a dietitian, it can't be a nutritionist, because allergy is a medical diagnosis and allergy management is a medical diagnosis. So yeah, just make sure that you're getting some evidence-based and supportive information. I'm just reading back through this message. Sorry, Kerry. 8 months old. 100% you need to go and see a dietitian. I wouldn't take no for an answer from a GP from this perspective at all. If you are cutting all of those foods out and reintroducing, we've also got to think about the nutritional implications, and that's something so often overlooked with exclusion, is that actually baby still needs to be getting all of the vitamins, minerals, big macronutrients, so things like protein and fat. So being methodical with allergy like you're doing, you know, reintroducing can be very sensible, but you 100% need to go and get some support with that one. That would be too much for me to kind of probably comment on right at this moment in time.
Okay, that's some amazing questions. Thank you, everybody. Lucy, how do people find you? We'll sort of wrap that up now because we have overrun by 11 minutes, but there were such amazing questions in there we needed to touch on. Tell people how they can get in touch with you.
So they can get in touch with me. So I've got an Instagram page, so at Children's Dietitian on there. I'm currently having my website rebuilt, so watch this watch this space. As I say, people might be able to access me in the NHS if they're local to my area. I do allergy clinics at my big local hospital. I do freelance work as well, and I do work with a wonderful paediatric allergist as well who works in the NHS, but we also do private joint work, which is always really helpful when you've got a doctor and a dietitian, because that's a bit of the dream team.
Yeah. So, well, I also was going to say that you can get in touch with us, Weaning Week, at Weaning Week on our social media pages, and obviously through the contact forms on our website. Hopefully we will do more with Lucy. We're very excited. It was a lovely workshop to end on, Lucy. Thank you so much. We do have an Instagram live happening today with What Mummy Makes, so we're very excited about that. So please feel free to join everybody. That's at 3 o'clock. Lucy, thank you for hosting that. That was amazing. And thank you everybody for taking part. And I hope you have a really relaxing bank holiday. Thank you.
Bye now.
Bye.